Good afternoon. So welcome back to another reading live. This is me Vandana PS joining you from Neetu's Academy. Okay, so today morning one of my students asked me about how to inculcate an interest in reading. Okay, so what about you guys? So how you guys are inculcating an interest in reading habit? Okay, any idea? Any answers? Let me know in the comment box. Okay, so another day. So we have another material here. Today, as usual, we will start with a sample question from part B. Then we will move on to the answer and as well as a new topic here, which is part A. Okay, I'll give you 2 minutes for the preparation of this particular question, and here comes the question. Okay, so welcome back to this particular question. So, did you all do this question? Okay. Yes, Sobi, Reba, Brincy, Jinu, Angel, good afternoon. So, I'm starting with that initial question, okay? So, what are your ideas or what are your concepts to do or inculcate an interest in reading? An interest in reading. Any ideas, any concepts? How can we inculcate, or how you guys are inculcating, okay, an interest in reading? Yes, Kavita, good afternoon, dear. Could you please share your ideas with me in the comment box? How you guys are inculcating an interest in reading. Okay. Yes, so you guys can think about it and comment it. Okay, so the question, I'm just jumping into this question. The notice reminds the staff that patients who are dying. Okay, so what are the keywords from the question? Any keywords from the question? What are your keywords from the question? So my keywords, notice, reminds, then dying. Okay, so first of all, as I told you in the previous class, let's underline the keywords from the question just to understand the particular question. Okay, so my keywords, notice, then patients, dying. Okay, and when you read a question, always connect with your options. So what is option A? Will need to be prescribed antiemetics. Okay, so will need to be, which means it is compulsory that you have to prescribe the medicine to this patient, the dying patient. Okay, so my keywords, need to be and antiemetics. Okay, so always connect with your option. So I have connected with option A, will need to be prescribed antiemetics. And option B, might not need to continue with certain medications. Okay, so what are the keywords? Not is there, so might not, then continue medications. And option C, should be encouraged to discuss their condition with loved ones. So should be encouraged, then loved ones. So these are my keywords from these three options. So any idea what is the correct answer here? Or may I know what is your answer? Whether it is correct or not, okay? So what is your answer? Okay, Reba, it's B, right? Okay, any other answers? What about others? Yes, Sobi, Brincy, Jinu, Angel, Kavita, any other answers? Okay, Angel, it is B. Okay, Sobi, it's A. Okay, Reshmi, it is B. Any other answers? Anyone got option C? Okay, Shabna, it's B. Okay. Then, any other answers? Other than A and B, anyone with option C? Okay, so let's read the paragraph, right? Okay, end of life decision making. So which means the patient is gonna die. Remember the 5 priorities when caring for a dying patient. So what are the priorities mentioned here? 5 priorities. So number 1, recognize that the end of life may be approaching. Number 2, communicate with patients, families, carers and staff. Number 3, involve patients and those close to them in decision making. And number 4, support the need of families and carers. Number 5, develop an individual plan of care for the patient. So these are the 5 priorities they have. Okay, and what about the paragraph? An end of life care plan must ensure the physical, psychological, social and spiritual comfort of the patient and should strive for the best possible quality of life for the patient's remaining time. This includes prescribing anticipatory medicines or medications which can be given as required, falling under the following categories, which staff are encouraged to remember as the 4 A's. So what are the 4 A's mentioned here? Analgesia, that's for pain relief, anxiolytics, which is for anxiety, then antiemetics, and that is for nausea and vomiting, and antisecretory, which is for respiratory and airway secretions. Okay, any unnecessary medications such as long-term diabetes control and blood pressure medications can be stopped. Then, a do not resuscitate decision also needs to be made. So that's all about the paragraph. Okay, Then we are doing the method that's called strategy, or the method of the strategy, which can be called elimination method or elimination strategy. Okay, a lot of answers here. Okay, 𝐉𝐮𝐧 got option A, 𝐻𝐿 𝐬𝐿, okay, option A. Okay, so then tell me, if your answer is option A, then from which line you got that particular answer? Any idea? If it is option A, then where it is mentioned. From which line you guys got that particular answer? Okay, or if it is B, then tell me, yeah, the same, which line? Or if it is C, where is it mentioned? Okay, Marin, it's B. Okay, dear. So what about B? Where is it mentioned in the paragraph? Okay, so part B is all about paraphrasing. Okay, so paraphrasing, which means that same meaning will be there somewhere in the paragraph, but exact different sentence structure will be there. Okay, so any idea where is it mentioned? In which line that particular option is mentioned? Okay, Shantiya, Nijay, it is option C, right? Okay, dear. Okay, Angel, encouraged to remember. Okay. Yeah, so your answer is option B, right? So where is it mentioned? Option B is actually might not need to continue with certain medication. So where is it mentioned? Okay, I'll start with option A. Will need to be prescribed antiemetic. So will need to be, which means, as I already mentioned, it is compulsory to follow this medication. But in the paragraph it is mentioned, see, this includes prescribing anticipatory medications which can be given as required, which means it is not compulsory. If the patient needs the medication, then you can give the medication. Otherwise, there is no need. Okay, so option A is, that can be called contradictory option, or I can say that is an opposite option. Okay, will need to be, it is not mentioned anywhere, it is compulsory, it is needed. If required, you can give the medicine. So that is contradictory option or opposite option. And what about option B? Might not need to continue with certain medication. Okay, so might not need to continue the medication. Why? Because the patient is going to die. Okay, so this kind of medicines, what kind of medicines? See, any unnecessary medications such as long-term diabetes control and blood pressure medications can be stopped. Can be, which means it is a particular word that indicates what probability may be or might be stopped. So that is the exact same line from the paragraph. Okay, so maybe, I have no idea, maybe. Then what about option C? Should be encouraged to discuss their condition with loved ones. So again, should be, which means it is compulsory. So when you read a question, always connect with your option. Okay, so what is mentioned in the question? The staff is reminded by what? The patient who are dying should be encouraged. For example, suppose I am saying, I am the nurse, okay, and I am just encouraging my patient. The patient is going to die, and I am encouraging my patient, okay, so please tell your loved ones that you are going to die tomorrow. Understood? So that is what is called encouragement, motivating my patient. So nothing mentioned about the staff is encouraging the patient to discuss their condition with the loved ones. Clear? So we can eliminate option C also, that is not mentioned. Okay, but in the fourth point, it's in the third point, they have mentioned involve patients and those close to them in decision making. But here also, nothing mentioned about the staff is encouraging them, motivating them. Is it mentioned? Not mentioned. Okay, so answer is option B. Might not need to continue with certain medication, and that is what the last line. Okay, any unnecessary medication such as long-term diabetes control and blood pressure medications can be stopped. Clear? Any doubts? Okay, if you have any doubts regarding this, you can comment it here. I'll reply. Okay, so be prescribing anticipatory medication. Okay, dear. Actually, prescribing anticipatory medication is mentioned, I agree, but that is what I said, it is contradictory. Okay, because in the option it is will need to, which means it is compulsory. Yeah, clear? Okay, thank you. Yes. Okay, Nino, it's B. Okay, Selin, it's B. Okay, Kavita, last two lines. Very good, dear. Yes. Okay, Nimisha, sorry, dear, it's not C. It is actually option B. I hope you clear it, right? Okay. Yes, Marin, in the last sentence, very good, dear. Your answer is option B, right? Yes. Okay. Yeah. So that's all about part B. Okay, so how many questions in part B? We have 6 different questions in part B. and it will be like multiple choice questions with 3 answer options, and you have a particular paragraph. Okay, and we have categories of questions in OET reading exam. Okay, so what are the categories? We have 3 categories, and this particular question is from the final category, the 3rd category, and this is a notice. Okay, so if it is a final category, then we are reading for the purpose. So purpose, which means an overall idea. Okay, so what is the purpose of this particular notice? This particular notice is giving you some information about the dying patient. Okay, so answer is option B. Yes. Okay, so now let's jump into the new topic of part A. Yes, so that is corticobasal degeneration. Okay, so how was the material? I think the material was very easy, right? Or average. Okay, it was not that much tough. How was the material? Yes, Nimisha, how was the material? How was the material? Sobi, Neenu, Selin, Kavita, Marin, Angel, Shantia. How was the material? Okay, so what about that particular question? So how you guys are inculcating that kind of interest in reading? Any methods for that, for your friends? Okay. Average material. Okay, dear. Thank you. Yes, Reba. Okay. Okay, Selene, it is not bad. Oh, easy material. Yes. Okay. Okay. So let's move to this material. Okay. Okay. Okay, Marin, it's a piece of cake. Very good, dear. And thanks for that particular idiom. Okay. Yes. Okay. Okay, Sobi, it's not that much tough. You took 11 minutes. Oh, very good. Yes. Okay, so I'll start with the timing. Okay, so for part A, let's complete part A within 15 minutes. Okay, so you have 15 minutes, and what are the important things that you have to take care of within this 15 minutes? So within this 15 minutes, we should complete 20 questions. So that is the first thing. Okay, 20 questions within 15 minutes. And what about that categories of questions? 20 questions. Okay, so 20 questions categorized into 3 different types. So 1 to 7, that can be called match the following questions. So when you read, okay, all these particular text A, text B, text C and text D, then reading the question, okay, 1 to 7 set of questions, and we are understanding, okay, from which text that particular question or that particular sentence is from. Okay, and we are just simply writing that particular text name there. If it is from text A, you can write A. If it is from B, you can write B. If it is from C, you can write C. Okay, so that's all about 1 to 7 set of questions. And 8 to 14, that is the second one, which can be called short answer questions. Okay, always answer to the question. So that is the particular question set that you guys will make a lot of careless mistakes. Okay, so please don't make any careless mistakes. Okay, so 8 to 14, which means short answer questions and answer to the question. Clear? And the rest of the questions, which is 15 to 20, that can be called fill in the blanks. Okay, Reba, very good, dear. 1 to 7 match the following, 8 to 14 short answers, 15 to 20 fill in the blanks. Excellent. Okay, then what about the strategy? It was a different strategy we used to complete that particular question from part B, but here we are using the strategy that's called skimming and scanning. Okay, and you know what is skimming and what is scanning. So today let's skim and scan and find out what are the important keywords from these different texts. Okay, as you can see here, one of the text will be, a pictorial, and here it is a chart, I guess, here. Okay, yes, skimming and scanning. Okay, then, so please comment here what are the important keywords from text A as well as from text B, text C and text D. Okay, I just want to know, I'm just curious about what are your keywords from text A, B, C and D. Let me know, please. Okay, Angel, headings, abbreviations, bullet points, italics, words, bracket. Okay, those are the keywords. Okay. And what about your keywords from text A? May I know? Okay, so what are the keywords from text A. It's a very small text, right? So what are your keywords from text A? Text B, text C, and text D. Okay, so I'll read. So within that time, you guys can comment here. So what are your keywords from text A? So corticobasal degeneration is a neurological or brain disorder. It damages cells in your brain, then causing parts of it to shrink, which means atrophy. The disease symptoms may first appear on the side of your body, but eventually affect both sides as the disease progresses. Then, with progression, you gradually lose your ability to talk, swallow, and move. This disease could also affect other areas of thinking, including judgment and memory. Okay, then corticobasal refers to the two parts of your brain the disease affects. Degeneration refers to deterioration or loss of function. Then the disease affects your cerebral cortex. This outer layer of nerve tissue aids your memory, learning, voluntary movements, and senses. Then basal ganglia. So what is that? This group of the nerve cells is critical for learning and motor functions. Then corticobasal degeneration is a rare brain disease. Diagnosis is challenging. Estimates indicate that many as 3,000 Americans may have this condition, but only about 700 have received the correct diagnosis. That is just an estimation about the prevalence of this particular condition, okay? Yes, so what are the keywords here? So what are the important words from this particular text? Okay, Angel. Yes, thank you for your comment here. Yes, atrophy, degeneration, shrink, corticobasal, basal ganglia, 700. Yeah, so what about 3000? Okay, it is important to mark all the numbers. So 3000 is also important. Okay, Shapna, atrophy, yeah, which is in bracket, corticobasal, degeneration, cerebral cortex, basal ganglia, then corticobasal degeneration, 3700. Very good, dear. Yeah, so what about others? So what are your keywords from text A? Okay, so I'm just marking the keywords as per your comment. Okay, so corticobasal degeneration, the neurological brain, then first appear, then eventually atrophy, that is in the bracket, progresses. Okay, so progress is a word that can be related with research. Okay, then another words, corticobasal degeneration, then cerebral cortex, basal ganglia, then 700, 3000, 2 parts, two. Okay, Americans, name of the country, diagnosis, something that is indicating experiment. Okay, so these are my keywords from text A. Okay, as well as I'm marking another word, that is estimation, because estimation is a word that can be connected with research. Okay, so brain cells, atrophy, talk, swallow, move, thinking, judgment, memory, corticobasal, two degenerations, loss, cerebral cortex. Okay, basal ganglia, then 3700. Excellent, dear. Then what about others? Any other keywords? Okay, so I think let's just move to text B. Okay, so what about text B? May I know? So what are these important keywords from text B? Okay, Riba, corticobasal degeneration, atrophy, thinking, memory, judgment, 3700, basal ganglia, 2 parts. Very good, dear. Okay, so what about text B? So, see, in each and every text, there will be some kind of, maybe text A is all about a particular disease condition. For example, I can say it's all about, schizophrenia. Okay, so maybe text A is all about the particular disease condition. And text B is all about the signs and symptoms, maybe. And text C is a particular, maybe a pictorial of something, maybe a table or a chart or a diagram. And text D, maybe it's all about research, outcome, result, medications. Okay, so likewise, we should have a clear understanding when you read these different texts. Okay, Okay, Reba, 60s, 40s, heading and all bracket words. Very good, dear. So signs and symptoms, first of all, we can mark. Okay, then the numbers 40s, 60s. Okay, then yeah, all those points we can just mark. Okay, it's not even in bullet point, but still short points mentioned. What are they? Balance problems and uncoordinated walking gait. Then difficulty swallowing, memory problems, muscle spasms, trouble completing tasks, difficulty coordinating fine movements, which means apraxia. Okay, myoclonus. Then dystonia, alien limb syndrome, bradykinesia. Okay, so difficulty controlling one limb. Then dementia, slurred or slow speech, tremors. So these are the important small points mentioned here regarding connecting with the symptoms, right? Yeah. Okay, so yeah, okay. Okay, Shapna, signs and symptoms, corticobasal degeneration symptoms include typical appear 40, 60, dystonia, apraxia, alien limb syndrome, bradykinesia, aphasia. Very good, dear. So where is aphasia? I missed something. Yeah, thank you for that. Okay. Okay, so B, signs and symptoms, 60s, 40s, balance, walking, myoclonus, dystonia, apraxia, alien limb syndrome, bradykinesia, dementia, aphasia, tremors. Very good, dear. Okay, Kavita, signs and symptoms, 60s, 40s, balance. Okay, balance. Very good, yeah. Okay, problems, difficulties, swallowing, memory problems, myoclonus, dystonia, apraxia, alien limb syndrome, bradykinesia, aphasia. Very good, excellent. Okay. So now you guys know how to mark these important keywords from all these texts, right? Yes. So now we are moving to text C. So what about text C? What is mentioned here? Yes, diagnosis mentioned, ascertaining the condition or identification. Okay, so diagnosis is a word, always we can relate with experiment. Clear? And what about this one? Yeah. So this is a particular diagram mentioned here, a pictorial. So what are your keywords from here? So what are the keywords from text C? Any idea? Okay, step-by-step procedures mentioned. Yeah, diagnostic, that methods mentioned here. Step 1, step 2. Okay, abbreviations mentioned. Yeah, some numbers mentioned, brackets mentioned. So may I know? Signs and symbols mentioned, yes, of course. Okay, so what about this one? Okay, so what about that one? Okay, Shapna, step 1, step 2, phenotype, yes, non-phenotype, abbreviations, 1 year, age less than 50. Okay. So what about others? Any other keywords? Any other keywords here? Yeah, so step 1, right? CRCBD, those an abbreviation, okay? Step 2, again CRCBD or PCBD. Then the bracket, neither. Okay, then CBS, FBS, NAPPA, okay, PSPS, and yeah, phenotype, neurodegenerative, progressive, then 1 year, table 17, 4, then CRCBD, again PCBD, age less than 50, then the bracket greater than 1, genetic mutation, CBS, again all other abbreviations, okay? Yeah, so that's all about that. Okay, Nimisha? Diagnosis, step 1, step 2, progressive abbreviations, phenotype, 1 year, less than 50, family, history, genetic mutation. Very good, dear. Excellent. Yes. Okay, it includes everything. Okay, so the last text D. So what about this one? So this is how we have a clear understanding about what are the keywords that we have to mark. Okay, and I'll tell you something. If you guys are marking keywords, and we have a strategy for that. Okay, so what are they? All the heading, all the subheading, all the numbers, signs and symbols, names, abbreviations, brackets, italicized or bold words, then the words that indicate time, then the words that indicate experiment, the words that indicate research, first and last line of each and every paragraph, as well as all the bullet points. Okay, and what about option, this particular text D? Management. So it's all about the management. The medicines used to treat Alzheimer's disease may also be used in CBD, such as donepezil or memantine. Then simple painkillers like ibuprofen can help irritability or depression. Okay, then sleep problems, bladder problems. Then a physiotherapist can give advice about how to remain safely mobile. Then regular exercise can help strengthen your muscle, improve your posture, and prevent stiffening of your joints. They can teach you breathing exercises to use when you eat to reduce your risk of developing aspiration pneumonia, a chest infection caused by food particles falling into the lungs. Then the occupational therapist can also arrange access to mobility equipment such as walking frames and wheelchairs. Okay, you may be referred to a dietitian then who will advise you about making changes to your diet, such as including food and liquids that are easier to swallow while ensuring that you eat a balanced diet. Then feeding tubes, okay, may be recommended for severe swallowing problems where the risk of malnutrition, weight loss, fatigue and dehydration is increased. You should discuss the pros and cons of feeding tubes with your family and care team. Okay. Oh, thank you so much, Sobi. Okay, that D is management, Alzheimer's, CBD, donepezil, then memantine, ibuprofen, depression, incontinence. Yeah, where is incontinence mentioned? Yeah, thank you. Okay, then physiotherapist, regular exercise, posture, joints, reduce aspiration, pneumonia, occupational therapist, walking frames, wheelchair, dietitian, balanced diet, feeding tube, malnutrition, weight loss, pros and cons, family, care team. Very good, very good. Yes. Okay, so now we are moving to the important thing. Okay, so that is 1 to 7 set of questions. Match the following. Okay, so tell me, what about the first question? Any idea what is the correct answer? The fundamental principles specified by the physiotherapist during the treatment period. Okay, dear. Kavita, management, Alzheimer's disease. Okay, donepezil, memantine, ibuprofen, irritability, depression, bladder problems, physiotherapist, breathing exercise, regular exercise. Also, you can mark the name of dietitian, okay? Yeah, dietitian, then occupational therapist. Yeah. Okay, so that's also important. Fine, okay. So what about the first question? So my keywords, fundamental principles, then treatment. Yeah. It's all about the treatment period. So what about that one, first one? So fundamental principles, which I can say instead of those words, important, the instructions, important guidelines, yes. Okay, very good, Marin. It's all about the management here, and that is from text D. Very good. Your answer is correct, which is from text D, because it's all about the treatment, management. Okay, so what are the things that you have to take care of when you do this particular treatment options? Okay, so that's all about the principles. Okay, the instructions that you have to follow. Okay, that's in text D. Very good. Second one. So any other answers? Anyone? Okay, the treatment, the management. So what about others? Okay, so what about Reba? Kavita, Sobi, Nimisha, Shabna. So second question, the preponderance of corticobasal degeneration. So preponderance is a very similar and familiar words to you. Word to you. So what is preponderance? So preponderance, which means prevalence. Okay. So what about the prevalence? And yeah, without any doubt, prevalence is mentioned in text A. See? Right? It is in text A. Yes. Okay, Reba. Very good, dear. It's from text A. Yes. Then the third one. Okay, Sobi, preponderance is your keyword. Very good. Yes, it is from text A. Third one. The age by which the prodromes typically onset. So prodromes, which means, again, it's a familiar word, which means the symptoms. Okay, so prodromes, which means the symptoms. So what about that one? The age by which the prodromes typically onset. Any idea? Third question. Okay? Any idea? So, I'm just moving to my initial question, okay? How to inculcate that interest in reading habit. So, the first important thing is, okay, you should understand, okay, and you should mentally prepare your mind that you guys are gonna attend an important exam in your life. So, definitely from that, okay, idea or from that particular dream, you can make an interest in this particular module. Okay, when you think about your dream country, when you think about your dreams, okay, when you attain your dreams, think about it. So definitely you can study, you can read this particular module. So that is the first simple technique. Then what about the second one? Any other techniques for that to inculcate an interest in reading? Okay, any other technique? Okay, so I'm coming back. So what about the third question? The age by which the prodromes typically onset. Okay, so that is from text B, the symptoms. See, signs and symptoms. The prodromes mentioned in symptoms. So what are the symptoms mentioned? A lot of problems mentioned here. Symptoms mentioned. Okay, and that's from text B. Clear? Then fourth one, the frequent symptoms of the condition. So my keywords are frequent, symptoms, condition. Again, without even reading the paragraph, without even reading the text, I can mark it as text B because, the symptoms mentioned in text B. Then the fifth one, what are the convolutions of feeding tubes? Yeah, here we have an unfamiliar word. That particular word is convolutions. So what do you mean by convolutions? Okay, let me know in the comment box, what do you mean by convolutions? Okay, so B, fourth one, symptoms. Yeah, so that's from text B. Okay, Merin, it's from text B. So what about fifth one? The convolutions of feeding tubes. Any idea? Okay, Merin. Yeah, feeding tube is mentioned in text D. I agree. So what about convolutions of feeding tube? Okay, and answer is from text D. Yes, your answer is correct. Okay. Okay, so B, only feeding tube. Yes, it is from text B. So my question is, what are convolutions? Any idea? So what are convolutions? Where is it mentioned? In connection with feeding tube. Can you guess? And you guys said, it's in text D. So what is mentioned here? Feeding tubes may be recommended for severe swallowing problems where the risk of malnutrition, weight loss, fatigue and dehydration is increased. You should discuss the pros and cons of feeding tubes with your family care team. Yes. Okay, so convolutions, which means the side effects, the impacts. Okay, so that means it is in text D. Very good, Anne-Marie. Pros and cons. Okay, Reba, not recommended here. Actually, convolutions, which means side effects, the impacts. Okay. Yeah, then sixth one. The parts of the brain generally contrived by corticobasal degeneration. So, parts, brain, contrived. So, what do you mean by contrived? Contrived, which means, what can I say? Affect. Simply, I can say affect. Okay. Any idea? Parts of the brain generally affected by corticobasal degeneration. Yes. Okay, Reba, any idea? Sixth one. Okay, so which is mentioned here. See the second point, okay? Corticobasal refers to the two parts of your brain. The disease affects. Okay, so which is from text A. Yes, very good, Sobi. It is from text A. Yes. Okay, seventh one. What are the standards to ascertain CR-CBD? So my keyword standards, ascertain, then CR-CBD. So without even looking, it's only mentioned in text C. See, CR-CBD. Okay, so that's from text C. Yes. So what about the first 1 to 7 set of questions? Anyone with 7 out of 7? I'm just eagerly waiting. Anyone with 7 out of 7? No. No 10 out of 7? Okay, so now we are moving to question number 8. So what about the 8th one? Okay. Very good. Okay, Sobi, very good. 7 out of 7. What about Reba, Merin, Shapna, Kavita, Nimisha, Angel? Okay, Nimisha. Okay, Selin. You got 6. It's okay, dear. Okay. Yes, Gopika, 7 out of 7. Okay, Anu Thomas, 7 out of 7. Very good. Yeah. Reba, Rijo, yes. Excellent. Okay, so 8th question. The summation of individuals who might have encountered corticobasal degeneration in the USA. So my keyword, summation, which means that total number of, people, individuals who might have faced corticobasal degeneration in the USA. So what about that one? The total number of people affected in the USA. I think it's all about the prevalence, right? So that number of people which is here, yes, 3,000, yes. Estimates indicates that as many as 3,000 Americans have the condition. See? Okay, so answer is 3,000. Yeah, which is from text A. So what about 9th one? Any idea, Anu Thomas? What about the 9th question? What is your answer? What condition other than CBD can be treated with the drugs called donepezil or memantine? What condition? So answer to the question. So name of the disease condition. What condition? Any idea? What condition can be caused? Yes. And I think it's from text D. Okay. So the medication's name mentioned here. Yes. Yeah, it's here. Then what about the name of the condition? Alzheimer's. Yes. Okay, it's Alzheimer's. So answer is Alzheimer's. Okay, so be very good. Yes, Merin, Alzheimer. Okay. Then 10th one. The part of the title that refers to the two parts of the brain where the disease affects. Okay, so the part of the title. So what is the title? Corticobasal degeneration. And the part of the title refers to the two parts of the brain. So which means it is corticobasal, direct answer, yes. Corticobasal refers to the two parts of the brain. Okay, answer is corticobasal, right? 11th one, the minimum age required by, so they need the age. Patients to show the symptoms of corticobasal degeneration. So what is the minimum age required? I think minimum and maximum is mentioned, right? Okay, so which is in text B, I saw something regarding the age. Yeah, in the first line. So degeneration typically appears when you are in 60s. Yeah, what is the minimum age? It is 40, yeah. Okay, answer is 40. Okay, so yes, Reba, yes, Shapna, it is 40s, yes. Okay, Maran, 40, yes. Okay, then 12th one. The deprivation of which constituents can be established if the duration of the symptoms lasts for 1 year. So my keywords, deprivation, constituents, which means the components, established, then last for 1 year. Yeah, so what about lasting for 1 year mentioned? Where is it mentioned? 12th one. Okay, and the 1 year, it's mentioned here in text C. So what is the correct answer here? Any idea? Okay, Libby, it's 40. Yes, dear. So what about the 12th question? Any answer? If it is lasting for 1 year. So what was the question? Question is asking you the deprivation of which components. Yeah, we need the answer. Which components can be identified, established if the duration of the symptoms lasts for 1 year. What is the problem? Okay, so the constituents or the components which are, it's CR-CBD or PCBD. So this is the answer. These are the components. Okay, phenotypes. The components, not CR-CBD or PCBD. So answer is this. Then the next one, 13th one, right? Yes. Yes. Who would issue retrieve to mobility equipment such as walking frames and wheelchairs? Who would issue? Who would give? Who would provide? Any idea? Who would provide? Okay, so who, which means name of someone. So I think name of somebody, it is mentioned here in text D. Physiotherapist, then occupational therapist, dietitian. So in comparison with the question, what is the correct answer? Yes. Occupational therapist can also arrange access to mobility equipment such as walking frames and wheelchairs. Okay, very good. Yes, Marin. It is, answer is occupational therapist. Okay, so answer is occupational therapist. So when you write the answer, it should be the occupational therapist. Okay, so the should be there because no articles mentioned in the question, so the occupational therapist should be the answer. Then 14th one, the term used to describe the condition where the patient finds difficulty coordinating fine movements. The term used to describe, so we need a term, a name. Okay, so what is it? Difficulty coordinating movements. So what is it? So difficulty, which means it is talking about the symptoms. Okay, the problems. So what difficulty? Related to coordinating movements. Okay, it's all about difficulty coordinating fine movements. That is apraxia. Okay, answer is apraxia from which text? Text B. Okay, then what about? Yeah, so that's all about that. Okay, apraxia, or yes, it is connected with difficulty in coordinating fine movements, which is from text B. Okay, yes, and that's all about that. So 15th one. So what about the 15th one? Apart from affecting the propensity to walk, move or swallow, the disease could also affect other areas of thinking, including judgment and. So what is it? Including and what? Okay, so which is mentioned direct answer from text A, and that is mentioned here, including memory, right? Yeah, so that is including memory. Okay, yes, answer is from text A. So memory should be the correct answer. So yes, sorry, it's not from here. Yeah, from the first para. This disease could also affect other areas of thinking, including judgment. That is also already mentioned. And memory. Answer is memory. Then 16th one. Dash may be recommended for severe swallowing problems where the risk of malnutrition, weight loss, fatigue and dehydration are increased. So what about that one? Okay, Libby, it's feeding tubes. Yes, answer is feeding tubes, and that is mentioned here in text D. Okay, so feeding tubes may be recommended for severe swallowing problems. So that is the question. Okay, so answer is feeding tubes. Very good. And what about 17? Signs and symptoms of corticobasal degeneration typically appear when people are in their dash. Okay, Anu, Nimisha, Marin, feeding tube. Very good, very good. So what about 17th one? Signs and symptoms of corticobasal degeneration typically appear when people are in their dash. Okay, are in their. Okay, it's 60s. Yes, that is from text B. Okay, are in their 60s. See? Okay. Then 18th one. Corticobasal refers to the two parts of the brain. The disease affects, whereas dash refers to deterioration or loss of control. Sorry, loss of function. Okay, so answer is from text A. It is degeneration. Refers to, yes, so that is from text A, degeneration. Then 19th one, the step 1 of the study is to identify if patient meets the criteria for CR-CBD. So what is the correct answer here? Step 1. So step 1 is mentioned here in text C. Yes. Okay, so what is mentioned? Identify if patient meets criteria for CR-CBD phenotype. So answer is phenotype from text C. Okay, and what about the last one? Dash can help strengthen your muscles, improve your posture and prevent stiffening of your joints. Direct answer. Okay, and that is mentioned here in management. Okay, so regular exercise can help strengthen your muscles. Very good, Anu. It's regular. Okay, Riba, regular exercise. Okay, Shapna, it's regular exercise. Okay, Libby, regular exercise. Yes. So anyone with 20 out of 20? Okay, any doubts? Okay, regular exercise. Okay, Nimisha, yes, 12th question, dear. 12th question is actually answer is CR-CBD or PCBD, which is mentioned in text C. Okay, CR-CBD or CBD. Identify if patient meets criteria. Okay, deprivation, which means actually the criterias, the problems. Okay, so that is CR-CBD or PCBD. That is the answer. Okay, and I think it is somewhere mentioned in the text. Yeah, somewhere else. Okay. Okay, so Sobi, what about your marks? Okay, Riba, 19, 11 minutes. Excellent, dear. Yes, okay, most welcome. Okay, Marin, Kavita, Libby. Okay, Riba, most welcome, dear. Okay, so that's all about today. So same time tomorrow. Stay tuned.